Hey guys, so I'm back. We had left off at the level of T12 with the thoracic aorta becoming the abdominal aorta. And in this level, that's where we have the celiac trunk. So we have the celiac trunk. Then just below that, we have the superior mesenteric artery. Then 3.8 inches above the bifurcation of the aorta into those terminal branches, we have the inferior mesenteric artery. So we start with the celiac trunk. The celiac trunk is surrounded by the celiac plexus of nerves, of course, being formed by the phrenic nerves, and it has three branches. The larger branch is the splenic artery, the middle branch is the hepatic artery, and a smaller left gastric artery. So the left gastric artery will supply the upper part of the lesser curvature of the stomach. Sorry. Then the hepatic artery will. Okay, let's start with the splenic artery. The splenic artery will run on top of the pancreas on the stomach bed, however, because it will arise, it will be posterior to the stomach. Then it enters the splenicorenal ligament when it reaches the left kidney, so it gets to the spleen. Then it gives branches that then run in the splenical momentum that goes to the stomach. That's the short gastric and the left gastroepiploic arteries. Those will be 6 in number. Then it then supplies the spleen by when it enters the ileum of the spleen. Then when we talk of that hepatic artery that we talked about, this is the common hepatic artery. Then it gives off at the end, that when we have the hepatic artery proper, the left and right that enter the ileum of the lungs, and then the right one, of course, will give the cystic artery, or it may arise from the main branch. It depends. Then talking of what can I say? From the main branch, we get the duodenal, the right gastroduodenal artery. This artery, duodenal, will tell you that it lies behind the first part of the duodenum, where we have in situations where you have lacerations of the first part of the duodenum, you may injure this artery. So it gives off the right gastric artery, which will anastomose with the left gastric artery, and then it also gives off the right gastroepiploic artery. And then we also have the superior pancreatical duodenal artery. Of course, where there is a superior, there is a what? There's an inferior. The inferior arises from the right side of the superior mesenteric vein. Take note, from the left side of the superior mesenteric vein, that's where we get the jejunal and iliac branches. But from the right, we'll now get arteries like the superior mesenteric is the artery of the midgut, so it supplies up until the distal third of the transverse colon. I'm sorry, I'm picturing pictures in my head, so that's where I'm talking from. And then gives that medullary artery, gives that it also gives that right colic artery and the iliac artery. Remember, the terminal branch of the superior mesenteric artery will anastomose with the inferior branch of this iliac artery. It also gives a superior branch that will anastomose with that right colic artery. Then it also gives an anterior and posterior cecal arteries. The posterior cecal artery giving origin as well to the the appendicular artery. Then we get to the inferior mesenteric artery, gives rise to that left colic artery, gives rise to the sigmoid arteries. Then when it crosses the left common iliac artery, it then becomes the superior rectal artery, then supplies the upper half of the anal canal, the rectum, and etc. etc. So these are the three visceral branches, anterior visceral branches of the abdominal aorta. With those lateral ones, we have the ovarian or testicular in male at L2. You have the renal arteries, and you also have the suprarenal arteries. Then we talk of the lateral abdominal wall arteries. That's those four lumbar arteries and the inferior phrenic artery. Then we talk of the terminal branches for abdominal arteries. Remember, in the previous video, I talked of that artery of Adam Crit that supplies the spinal cord. It also may arise at any point or in the lumbar region, depending with the person. Then We also have the terminal branches is the common iliac, and the right and left common iliac, and the median sacral artery. But then this common iliac will then bifurcate and give you an external carotid and not carotid, external iliac and an internal iliac. I will pursue the external iliac for purposes of longevity, and it's the one that I understood most. I will neglect the internal iliac for reasons best known to myself, and it's a bit hard. So this external iliac artery will give rise to two branches: the deep circumflex arteries and the inferior epigastric arteries. The inferior epigastric arteries then gets into the substance thoracis abdominis behind the artery line, anastomosis with the superior epigastric artery. Remember, it was a continuation of what? It was one of the terminal branches of that internal thoracic artery. Then you have the deep circumflex arteries, of course, going to the anterior, superior, inferior iliac spine. Then the the external iliac artery will then cross the inguinal ligament. The inguinal midway between the pubis symphysis and that anterior, inferior, superior iliac spine. Then it becomes the femoral artery. Then this femoral artery will then give rise to three superficial branches. If that's superficial epigastric, superficial what? Circumflex, superficial circumflex artery, and then the superficial pedental. Then it also gives a deep pedental. Remember, we said superficial pedental, deep pedental. Then it also gives a profunda femoris artery that arises from the lateral side. This profunda femoris, together with the obturator artery from the internal iliac, will supply the medial compartment of the thigh. Then profunda femoris will give perforating branches, and it's of becoming continuous as the fourth perforating artery. These perforating arteries will supply the posterior compartment of the thigh. And then we also have the deep descending genicular artery arising from the femoral artery. Then this femoral artery will then enter the popliteal spurs in the space created by the adductor magnus to become the popliteal vessels. These popliteal vessels, I will not dwell much on them. And then at the lower part of the popliteus muscles, these vessels will now divide into an anterior and posterior tibial arteries. The anterior tibial artery will be the artery of the anterior compartment of the leg, and it will have the deep peroneal nerve lying first lateral, then anterior, then lateral to it, then goes beneath the extensor retinaculum comes the dorsalis pedis artery. It gives lateral tarsal arteries and so forth. On the posterior surface, we have the larger branch now, that's the posterior tibial artery. Then it gives rise to a peroneal artery, a common peroneal artery that supplies the lateral compartment of the thigh. Sorry, not of the thigh, of the leg. We're talking of the leg here. Sorry about that. Then we also have then the tibial nerve will start on its medial aspect, then goes to its anterior aspect, then lies lateral. Then when it gets to the plantar aspect, it divides into medial and lateral plantar arteries, with the medial one being more prominent. Then what else have I missed? Then so the superior gluteal and inferior gluteal will participate in the trochanteric anastomosis. These are branches from the internal iliac which we neglected. But then the superior gluteal one will not participate in the cruciate anastomosis. We add the first perforating artery of what? Of the profunda femoris. We minus the... So each anastomosis has 4 vessels. Then... what else have I left out?